And you see, because I don't want to be triggered tonight and cry any further for what is happening in my country, the Ministry of Health is saying that they're reviewing the kind of crisis that is in our hospitals right now. After 9 years, the ministry is just now reviewing the crisis that is in our hospitals. Listen to this tonight, Jamaica. Listen to this. Listen to this, Jamaica. Tufton is saying that he's reviewing the crises now in our hospitals. Listen to this tonight.
I am welcoming the Minister of Health and Wellness recent public admission that Jamaica is in the midst of a healthcare crisis. For months, the minister has criticized anyone who used the word crisis to describe the collapsing public healthcare system. His eventual concession is a welcome step, but he continues to frame it only as a staffing issue, ignoring the broader systemic collapse. There are several key indicators of the crisis, each supported by recent reporting. There are ventilators left idle while ICU beds are empty and patients wait and die for those beds. Despite mounting reports of unused ICU ventilators, the minister previously declined calls to address this. Staff burnout forces life or death triage decisions. PAHO has warned of healthcare worker shortages. The minister has already admitted that Jamaica is amongst the hardest hit. The premature infant deaths at the Victoria Jubilee Hospital due to inadequate staffing is just one example of how staffing impacts the quality of care of Jamaicans. The situation continues to worsen to suboptimal care stemming from personnel shortages in overcrowded A&E departments and understaffed clinics. In spite of this, recent reports reveal nursing graduates remaining unemployed, and next month, doctors will be unemployed despite severe shortages across the system. A crisis has been repeatedly denied and downplayed, even as we have warned of theater downtimes affecting cancer patients. This is not just a staffing issue. It is a healthcare crisis, a full-blown crisis. Jamaicans are paying with their lives. While we welcome the minister's admission as a road to Damascus, I am urging immediate, substantive action, robust workforce planning, retention initiatives, and transparent audits with a commitment to honest communication. Recognition without delivery leaves patients in corridors, theaters idle, and ICUs filled. This is unacceptable. Jamaicans deserve solutions. Recognition without delivery leaves patients waiting in corridors, theaters idle, and ICUs overflowing with critically ill patients, adults and babies. That is unacceptable. Jamaicans deserve solutions, not another PR spin.
Wow. Listen to this other aspect, Jamaica, where they are saying that they are reviewing. This is the Tufton and the government now. Listen to this.
The Ministry of Health says it is currently conducting a needs assessment to determine the resources required across the health sector. Now, this includes the creation of more posts to accommodate nurses graduating from training schools. Shamela Pullen is at the Nurse Practitioner of Jamaica Conference in Trelawney, where the issue was raised.
In the recent World Health Organization State of the World's Nursing Report 2025, it was revealed that the number of nursing graduates has declined in the Americas. This presents a significant threat to the sustainability of the profession in the region, where 40% of countries already have less than the WHO recommended 30 nurses per 10,000 population. In Jamaica, some nursing graduates are unable to find jobs, this even in light of a chronic shortage. Chief Nursing Officer in the Ministry of Health, Patricia Ingram Martin, explained there are currently about 6,000 nurses in the public hospitals and health centers, though the system needs around 11,000 to function properly.
We do have nurses who are not employed, persons have been applying to our institutions, but the challenge is that we do not have enough posts. We do not have the posts for these nurses to be employed. There was a time in the past when nurses were, although there was a need, they would have been employed in excess. So although there were no posts, they were still employed.
She says it reflects a deeper structural challenge within the healthcare system.
Our cadre, our establishment is really archaic. That was from in the 70s. And so we have limited number of posts that we have. And although in recent times we would have gotten up about 1,500, that still is not in keeping with the needs that we have in our health system now. Because over time we would have developed our services, we would have built more hospitals, and we have added more essential services, and so there is a need for these nurses.
To address the situation, Mrs. Ingram Martin says the Health Ministry is undertaking a comprehensive needs assessment. This process will evaluate the current availability of services, identify resource gaps, and help determine the staffing and infrastructure needed to meet growing healthcare demands.
We will need our nurses and our midwives to work in these institutions. So the ministry has done a needs assessment of all the needs that are coming on stream and that are already here. And we are looking to see what we will now request from the Ministry of Finance in terms of additional posts.
The Minister of Health is unable to give a timeline as to when these posts will be made available. However, it is reassuring nurses who are unemployed that they will be able to take up jobs in the public health system soon. Reporting from the Nurse Practitioner of Jamaica Conference in Trelawney, I'm Shamila Pullen for TVJ News.
I'm sure recently you were told there's a shortage of nurses on the island. And that is why Christopherton had to go to Africa and India and Indonesia to go and recruit nurses. But now you're being told that nurses are here, but they can't be employed. So it's not an issue of shortage, it's an issue of employment or employability. And then Jamaica, on top of that, he flew first class with his friend from the university, the doctor from the university, Dr. B, and him go first class to India, Indonesia, and Africa trying to recruit. But our own nurses are here wanting to work, but you are not being granted the opportunity to work because Tufton and the policy and the ministry has not filled those gaps. He took $3 million, Courtney, to go on first class plane. And the nurses are here that could fill the gap. So I am as confused. 3 million. I'm very confused like you, Andrew Mack. Andrew Mack said me confused. Anybody would be confused. The nurses are here. The nurses need to be employed. But the government is not freeing up the money to put in the vacancies to employ them. Madness! Recipe for disaster! This Jamaica is a recipe for disaster. Can you imagine? And then on top of that, Jamaica, he did a recruitment drive saying he needs specialized people. And see there now, out of them, they said them have 600 posts. You remember? Yes. Long line. People suffered and went through those long lines. People suffered and went through those long lines. And you are telling me, Jamaica, him and him friend go up on trip First class trip. Recruiting, and can you imagine the nurse? Yeah, what the nurse lady say? It is anarchy. It means that it is chaotic. Taxpayer money sent in pan trip. And the nurses are here. Because what? They don't want to pay the nurses the right equivalent of money in Jamaica. So they want to go for the subpar nurses. Many of whom don't even have a certification. The Africans and all of them, they carry them over a year for further killing off. Experiment pound. Turning a monkey and zombies. Mummies. They are evil, Jamaica. They are the epitome of evil, and you must shun them. Shun them, Jamaica. Shun the very appearance of evil. They are evil beyond Jamaica. It's not a case that the nurses are not here. Give them some work. Give the people them some work. Free. You know what? I'm not talking to you anymore. I want to talk to Alfred Dawes. I want to talk to the next Minister of Health tonight. Because we don't want to talk to the Doctor of Death anymore. We must be futuristic. Let us talk to the future. Let us talk to the future Minister of Health. Let us speak Jamaica tonight to the future Minister of Health. Dr. Dawes. I know Jamaica is at a crossroad and healthcare is in serious problems, but Dr. Dawes, you got to fix it. Dr. Alfred Dawes, you got to fix it because too many Jamaicans are dying, too many crosses and ills in our way, too much sacrifices, too many experiments. Let us talk to the real doctor tonight. Can I get a picture of Dr. Dawes? Dr. Alfred Dawes, good night, sir. Minister of Health in waiting. Dr. Dawes, you explicitly stated everything that is happening and you understand the dynamics of the crisis happening in healthcare. Dr. Dawes, we cannot continue like this, sir. Sir, we cannot continue like this. I am asking you, Dr. Dawes, rescue healthcare. Please. Dr. Dawes, when Tyne was dying that night, you heard the cries on the phone. And you asked me, Andre, hold it together. Me, I beg you, Dr. Dawes, for the crisis in healthcare, particularly for the children and mothers in healthcare, let that even be a priority to fix in the first 100 days. Dr. Dawes, the gap, the crisis is so much. The crisis is so much, Dr. Dawes, that I'm asking you. May I hold it together? You said to me, say, Andre, hold it. May I ask you tonight, Dr. Dawes, for Tyne right and for the mothers and the children at all of those hospitals, fix it for me, Dr. Dawes. Fix it for me.
Stay tuned for more PDTV News Evening Highlights. Remember to show your support. Comment, like, share, and subscribe. Thank you for watching.